I'm here with Dr. Josh Clayton, State Epidemiologist, and Kim Malsom-Risden, Secretary of Health. Dr. Clayton will give an overview of today's cases, and then Secretary Malsom-Risden and Dr. Clayton will take your questions. I'll turn it over to Dr. Clayton for today's update.
Good morning. Today we're reporting 69 new cases of COVID-19 in the state. This includes 10 new hospitalizations, 0 new deaths, 58 newly recovered individuals from COVID-19, as well as 578 new negative tests that have been performed. In total, that brings our case count of COVID-19 in the state of South Dakota to 3,732 cases. This includes 1,326 active infections, as well as 2,367 individuals who have recovered from the virus. We have 281 hospitalizations, 39 deaths, and 22,112 total negative tests that have been performed. For the community impact map, we have 2 updates. Beadle County has transitioned from no to minimal to moderate community spread, and Todd County has transitioned from minimal to moderate to substantial community spread. For cases by county, we have 11 in Brown, 1 in Charles Mix, 1 in Clay, 1 in Coddington, 1 in Grant, 3 in Lincoln, 1 in Meade, 39 in Minnehaha, 2 in Moody, 2 in Oglala, Lakota, 4 in Pennington, 1 in Todd, and 2 in Yankton. For cases by age range, we have 5 in the 0 to 19 year age category, 18 in the 20 to 29 year age category, 13 in the 30 to 39 year age category, 9 in the 40 to 49 year age category, 19 in the 50 to 59 year age category, 4 in the 60 to 69 year age category, and 1 in the 70 to 79 year age category. For new cases by sex, we have 30 that are male and 39 that are female.
All right, thank you, Dr. Clayton. I'll now unmute the lines and we'll take your questions.
This is Morgan from Rapid City.
The leader has muted your line. To unmute your line, press #6.
Morgan, go ahead. Morgan, go ahead.
Can you hear me?
Yes, I can hear you now.
I unmuted and then it said you muted my line, so that was confusing.
Okay.
I have a question today. How many of the 36 Pennington County cases are coming from Oyate Health Center? They've reported 16 so far from the hospital, and we've heard there are 4 connected to the Lacrosse Street Walmart. Can you confirm any of this?
So we're reporting 4 total cases today that are associated with Pennington County.
Okay, yeah, but can you confirm whether any of them are connected to the Walmart in Rapid City, or whether any of the 16 of the 36 are connected to Oyate?
I mean, I don't have the breakdown of who has been reporting positive cases. That's something that you can request through our communications team. What I can say is that we have 2 known cases that are associated with the Walmart out in Rapid City.
Okay, so if there are 2 cases, I asked from...
Morgan, neither of the cases at Walmart had an exposure risk to the public.
Correct. We would have processed a public disclosure if those individuals had posed a risk to the customers, which is defined as having an exposure of 5 or more minutes within a defined proximity of less than 6 feet.
Okay. Were they maybe working in a place that they didn't have close contact with customers, or what made this different from any other business that you report out?
So some of the differences can be the actual environment in which they're working, and so they could be working in places where they don't have much contact. There's also, it depends on whether there's physical barriers, and it also depends on whether people were using personal protective equipment in terms of their exposure risk. So there's several different factors that come into play.
Okay, and can you talk about how IHS gets reported, like the further positive cases, how they report those to the DOH, or?
Yeah, so we have our disease reporting website where we, as part of our routine business for all reportable conditions in the state, the individuals are able to report COVID-19 positive cases. We also ask and have all of the laboratories who are testing using the Abbott ID Now machines using that same reporting feature for our negative tests. So that is an active portal for us to receive testing information for individuals that are performing those tests and reporting those to Department of Health.
Next question.
Megan Morat, News Center 1.
We'll go with Megan with News Center 1.
Hey, I got two questions. First, how is the state maintaining daily case tracking, and how are you able to keep up with every active case every day?
So we are able to keep up with the new cases that are coming in on a daily basis. We do have the notice that once we have received that case, it's prioritized that it is to be completed within about 24 hours, which means that sometimes it's the same day, sometimes it's next day, but we do have a priority of getting to those within about 24 hours. Sorry, what was the second piece?
How do we get the cases are reported to us electronically through electronic lab reporting?
Yes.
Yeah.
And so, and that's been in place for some time, so that's not necessarily new to COVID, but we have an electronic system that gets that data.
Okay, are you able to keep up with those cases every single day until they're considered not active anymore?
Yes, we are.
Okay, and then my next question is, you mentioned yesterday that the CARES app has kind of come in handy with one case. So what other ways are you keeping up with contact tracing, and just how are you doing that?
Sure. So some of the ways that we've been able to keep up with the contact tracing include surging staff. We've greatly increased the staff and staff capabilities of that unit. We have National Guard that is helping us with that contact tracing, and so we've been able to assign some of that work to other individuals. The other thing that really helps us after we've made contact with those individuals is that they are enrolled in a text illness monitoring system, and so that helps us help them keep track of their symptoms and get them in for testing if they were to show symptoms into the future. So we use technology in that way as well.
All right, next question.
Jeremy Spiegelberg, Forum News Service.
Go ahead, Jeremy.
Hey, yeah, so it's been 2 weeks now since I think you posted the 2-week look back for trend, for a case trend for positive cases. And I just wondered if those numbers posted on the state's COVID site were going to be updated.
So this is Dr. Clayton. We're looking at that now. We want to make sure that we're, as best as possible, not accounting for any changes in overall testing. So any mass testing event we're trying to remove from the overall trend data, as that is not a representation of where our case counts are really coming from. Those mass testing events are identifying additional specific cases around that event, in that they're testing not only individuals who have symptoms, which would be appropriate for testing, but testing individuals who are asymptomatic, which is not part of our normal, algorithm for individuals to seek care and to receive testing. And that does have and would bias any of the trend line results that we would be putting out. So we're in the process now of finalizing that and hope to have that out soon.
So just to clarify that, the testing numbers from Smithfield that were factored in to the previous trends, you're ruling them out here because it's kind of apples and oranges because they include asymptomatic testing from the mass testing event?
Exactly. The difference that we've had before is that all individuals were required to have symptoms of COVID-19 before they could be tested. And the change is that those mass testing events include individuals who are asymptomatic, so you're exactly correct.
Okay, thank you.
Next question.
Hi, Todd Epp, Hello.com News, Sioux Falls.
Go ahead, Todd.
Thanks. I don't know if Dr. Clayton or the Secretary wants to take this, but Monday, President Trump once again said if somebody wants to be tested right now, they'll be able to be tested. And then even after he was corrected by one of his health officials, he again said, if you want a test, you can get it. Now, and I understand some states are testing everybody. South Dakota, I believe you've said that, you're testing only people that you think may be at risk or are showing symptoms. Why do you think the president is confused on this issue if most states are not testing?
I'm not sure that we can really weigh in on that. I can tell you that the testing strategy that we've had as a state has evolved over time, and we expect it will continue to evolve as new technology becomes available and new testing capabilities come online that show us different, different ways to measure the spread of COVID in our state. And so, again, I can't really comment on other people's comments around that, but I can tell you that since we've started down this track, that our testing strategy has evolved and it will continue to evolve.
Next question.
Yeah, just quick follow-up with the Secretary. Do you foresee a time in South Dakota where everybody who wants a test could get a test?
I foresee a time when we have more than just the PCR testing that is the most validated and effective right now, and where we see more of availability of antibody testing, which shows if a person has actually encountered COVID and has any antibodies in their system. I think we anticipate that to be quite widely available, but that's different than saying, do you have COVID right now? It shows if you've ever had COVID.
Great, thank you.
Question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Just wondering how many cases are connected to Demcota at this point, and how many have recovered?
So we have 82 individuals that are associated with the Demcota beef plant, and I don't have the number that have recovered, so we can have that prepared for tomorrow.
Okay, and just wondering, outside of those cases, is there any concern about the number of cases in Brown County and any hotspots or anything like that in other businesses?
I think, we're always looking at, where are we having cases that are occurring, but at this point, we have no, specific hotspots that have been identified, so I think the focus here is just on continued vigilance, both for the medical community, for businesses that are having their employees coming into work and making sure that they're doing appropriate screening so that we can identify cases that are occurring in counties.
Okay.
Next question.
This is Joseph at the Capital Journal.
Go ahead, Joseph.
Good morning, y'all. Thank you. I was wondering if you can do an update on the Smithfield cluster. How many employees and close contacts with we're close to being out of numbers there, so.
Yep, you are correct. So we have 825 Smithfield employees that have recovered, and 244 close contacts to those Smithfield cases that became cases that are now recovered as well.
Next question. Any final questions?
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Just wondering on the contact tracing, is the DOH also doing the contact tracing for patients with IHS and the VA?
Yep, we do the investigation and related contact tracing for any South Dakota residents who test positive, whether that comes through IHS or VA or other labs.
Yep, and what I would say is that we do work closely with IHS, specifically through their public health nursing. They are invaluable collaborators in making sure that we're getting both a hold of individuals as well as helping with any wraparound services that are needed for individuals and families that are in isolation or quarantine.
This is Carlene Wild with Dakota News Now.
Go ahead.
Two quick questions. One, the state's been processing around 600 cases per day lately. Do you anticipate that being the standard going forward?
Well, Carlene, I think we anticipate more testing, certainly into the future. And so as the testing supplies become more available and we just have more opportunities to do that, I think the numbers will increase. Okay.
Just real quick, too, then, I noticed yesterday on AP, and then we're seeing more stories about how some of the PPE that is being shipped out or ordered is coming in either not up to the standards, or yesterday I think the AP story labeled it fake. Are you concerned about that, and what steps can you take to ensure what you are getting in light of the fact that it's been really tough, is exactly what you need?
Well, Carlene, thanks for highlighting that issue. I can tell you that since this whole event started, we have been bombarded with companies seeking to sell PPE from domestic and international sources. And so I think it's really important that people vet whoever they might be buying PPE from and make sure that they're reputable, that they have a history of providing those kinds of products, that you're not making payments up front, because we've heard some stories, not of happening in South Dakota, but in other places where shipments, were paid up front and never arrived. So we are very careful to vet anybody that we would be working with to secure PPE and have great success in doing that, as well as getting help from our federal partners in making sure that the PPE that we're getting and distributing at the state level is of the high quality that our people need.
All right. Thank you all for joining us this morning, and we'll talk to you tomorrow.